yesterday, for those of you who are here. Thank you for coming for our briefing this afternoon. We have a few updates, and then I'll of course take your questions to the best of my ability. Just to start off with the numbers, we have 198 cases to report today, and that represents an increase of 28 cases since the report yesterday afternoon. For the state of Tennessee, at the moment, the Tennessee Department of Health is reporting 784 cases. That number may change by the end of the day, however. In Tipton County, in our area, we're seeing a report of 6 cases. DeSoto County, Mississippi, we're seeing a report of 36 cases. And Crittenden County, Arkansas, we see a report of 7 cases. So those are the reports that we have from those other jurisdictions at this time. Of course, as we investigate cases, if they have been tested in Shelby County, but we discover they reside somewhere else, we always transfer those cases to the appropriate health jurisdiction, and we cooperate with those jurisdictions all the time on all kinds of reportable diseases. And as far as what are we seeing in the numbers and what are we seeing in the data, of course the positives continue to increase. We have not reached a plateau of reported cases yet. And because of that, we want to emphasize there's still evidence that transmission is occurring in the community. And the best way that the community can help us slow that transmission down is by adhering to the social distancing strategies, the health directives to stay at home, the safer at home orders that the mayors have placed out. Those orders and those recommendations and guidelines are going to help us stop the spread of the virus through the community, or at least slow it down so that we can ensure our healthcare system does not become overwhelmed. That's the whole point of the recommendations. And we do want to emphasize a couple of points also. We know that their school systems have been closed, children are at home, and we want to support both needs. Children, of course, do want to go outside. It's a beautiful day, but we also need to make sure that those children are safe and those families are safe as people do that. The stay-at-home orders don't preclude going outside, but if you're outside in the backyard, or you're outside walking the dog, or you're outside in a park, we still ask you to maintain social distance from other people, not interact directly, not have interactions within 6 feet of each other while you're out getting some sunshine and fresh air. And avoid those handshakes and close contacts with other people and hugs that we're, here in the South, we often hug each other. But right now is not the time to do those sorts of welcoming greetings. You just maintain a social distance even as we are interacting with friends and loved ones that we may come in contact with them frequently. We want to talk especially about our seniors and other people at any age. If you have certain underlying conditions, this virus increases your risks. So if you have asthma at any age, if you have chronic lung diseases of any kind, if you have diabetes at any age, if you have any immunosuppressive conditions at any age, this virus poses a greater risk for you. And then additionally, of course, the older populations have an increased risk by age for bad outcomes or hospitalization or death. So, but we want to emphasize it's not only elderly people, it's also people with underlying health conditions. If you need a complete list of the underlying health conditions, those can be found on the CDC website and Tennessee Department of Health websites as well as ours. We do still want to maintain a cancellation or postponement of gatherings of people that have 10 or more people involved. And that would be whether that's a workplace gathering or a social gathering. We want to not have those large gatherings. And as far as if you are experiencing symptoms, if you yourself are coughing, having respiratory symptoms, having a fever, please do not go out. Please do not go to work. Please do not interact with the world outside your home any more than you must. And before going to the doctor's office, call and let them know of your symptoms so they can talk with you about the safest way to do so, to come in if you need to see a healthcare provider. avoid flying and other things like cruising and other non-essential travel. If you must travel, please travel by car and not in large groups of people. And to the greatest possible degree, stay home. To the greatest possible degree, stay home. If you have the ability to work from home, please work from home to lessen your opportunity to be exposed to the virus. Wash your hands thoroughly and frequently with soap and water. Of course, if you don't have access to soap and water, you can still use hand sanitizer, but when you can use soap and water, use soap and water, because that will also stretch out how long your hand sanitizer lasts. So we would encourage you to do frequent hand washing with soap and water and use hand sanitizer in between. But especially whenever you've interacted with high-touch surfaces, doorknobs, railings, countertops that other people are touching, or in a workplace environment, if you have to work on a keyboard or a telephone or anything that other people also use, make sure those high-touch surfaces are disinfected frequently, and that whenever you touch those surfaces, you wash your hands or use hand sanitizer afterwards. Please, once again, continue to avoid touching your face. I know it's not easy to do, but when you've touched surfaces and got viral particles on your fingers, and then you accidentally touch your face, your lips, your eyes, that could be a route of transmission for the virus into your body. For business leaders and the business community and employers, we would just say, please help us reinforce that if an employee has symptoms, that they are not supposed to be at work, and you support them in staying home. That's a key recommendation that we have. Cancel or postpone your meetings or conferences involving 10 or more people, and if you can hold as many meetings virtually as possible by webinars and WebExes or phone conference calls, anything that can have virtual meetings instead of face-to-face meetings, that's a good idea. And try to disinfect those high-touch surfaces at work, phones, computers, keyboards, countertops, doorknobs, anything that people touch frequently. Make sure those are being frequently disinfected by your cleaning staff. As far as other statistics to share, we do have some statistics to share from the call center. Today or yesterday we had 198 calls, and we have fielded so far in our call center at the Shelby County hotline 1,460 phone calls, and that number is 833-943-1658. And so if people have questions about the recommendations or guidelines, or they're calling with need for information on who they can talk to about seeking healthcare or getting a triage from a doctor's office, and you need a referral or something like that, you can call that number and we will be happy to help you out Monday through, well, actually 7 days a week from 8:30 to 4:30, 8:30 in the morning to 4:30 p.m. With that, I'm going to stop and take your questions.
David, I have an update on the Tennessee
numbers?
Yeah.
Yes, what's the number?
So Tennessee Department of Health just updated their website. They are now reporting 957 cases in the state of Tennessee. Tipton County is reporting 8 cases. So the numbers change all the time. We give you the most accurate numbers as possible, but there is a lag in the reporting of laboratory results to the State Department of Health, and that accounts for some of the discrepancies that you see if you check the different websites.
Yeah, it always depends on what time of day you check, because the Tennessee Department of Health, for instance, updates their website once a day, and we also update our numbers once a day, but 24 hours a day, reports are coming in. So we tell you at a specific point in time what the count was at a specific point in time, but obviously the next time we go dip into that river, we'll come up with a different number out of the sample. So, any questions?
Of the 198 that's that has been tested, how many are quarantined at home and how many are hospitalized?
We don't know the number hospitalized at this moment. That is one of the things that we ask in our investigation, but a lot of these are pending investigations or investigations in progress. So I can't tell you how many people are currently in the hospital at this moment, but I'm sorry, what was the rest of that question?
How many are at home
I mean,
self-quarantining?
right, at this point, that's part of what we're trying to sort out. I mean, when we get a laboratory report, we get a name and the fact that they have a positive lab, but then we have to go interview them and determine the answers to all those questions. There's a process to get that information. I'm sorry, there was a question over here.
David, I was
Yes.
wondering, or you can go first.
Go first and then I'll go to you.
Yesterday, the statistics, the people were so interesting. Do you have any updates on that?
I don't have any new analysis of the age breakdown. We'll rerun that analysis periodically, but certainly yesterday, as was reported, we saw 74% of the cases that have been tested so far were 60 years old and younger. 26% were over 61 years of age. And since we've only added 23 new cases to the total, I doubt those percentages have changed a lot. They may have changed some, but we'll reanalyze that periodically and update you with that with new information. So,
We had seen some numbers from the task force that meets every morning about the number of people that are being monitored by the health department jumping dramatically from what it was Wednesday, around 200 people to around 500 people today. Is that because you are identifying close contacts of positive cases, and what is happening with people that are being monitored right now?
right. So there's different numbers that you may have seen. I don't know which one you saw. We have had a total, I mean, when I checked this morning, we had a total so far of 463 people go through the monitoring process. I haven't seen a number of 500, but that includes people that we've already cleared, plus those that we're actively monitoring at present. And I'm getting an update later this afternoon because as I mentioned yesterday, we had 120 cases reported in the prior 3 days. We had another 23 today. So there's been a little bit of a lag of data entry, and we're updating those numbers that we've cleared out so that we can say how many we actively are monitoring. I don't have that number yet, but we'll have it by the end of the day.
What happens
When you
when
look
somebody
at-
gets monitored? Do they,
What
what
happens?
goes on during the
Yeah,
monitoring?
what happens in a monitoring process, when we've identified somebody, they're a named contact to a case. Or in the past, we were also monitoring travelers returning from countries at high risk. We would make contact with that person. We would explain, based on their exposure, when they need to stay home. It's 14 days from your last exposure date, but we have to establish in conversation with the contact what was that exposure date. And then we can tell them when they would need to stay quarantined at home because of contact with a confirmed case. For cases, we would also say, okay, you've been confirmed, but we would go over the isolation orders that they need to be under for how long. And then we would establish a relationship and call them every day and monitor them for fever or progression of signs and symptoms. And then if they get to the end of the period of time and they have no signs or symptoms, then we clear and release them from monitoring. They're able to go back about their business. So, sorry, yes.
When you look at the number of confirmed cases in Shelby County, we've seen in the past few days, one day it was 55, Tuesday 35, and then yesterday, I believe, 25 new cases. Does that mean that the curve is flattening in the county, or is it too early to tell?
Yeah, it's too early to tell. It's too early to tell because the uptick in cases is still faster than we would expect to have the virus doubling the numbers. We're still catching up and documenting the illness that's already in the community. We haven't reached what we would consider as enough days in a row that we could say, all right, we've hit a plateau. We're continuing to watch that, and one of the things that makes it hard to answer that question is the number of test sites and the number of doctors. The access to testing just continues to increase, and so yesterday, for instance, the city reported out at Tiger Lane a significant number of people got tested. So that's a brand new test site, a brand new group of people being tested. So every time that happens, the number of people being tested increases, and that changes the data streams, and we don't know yet whether we've hit the plateau.
There's also a restaurant that is talking about doing an outside gathering event at 4 o'clock today. Do you recommend that?
I have no information about that event. That's the first I've heard about it. We're certainly not encouraging dine-in traffic. We're encouraging people to do takeout and to have food delivered. That's what's been recommended in the orders from the health directive of the health department and the orders from the mayors.
But if it is outside, I mean, is that something that you would recommend?
I don't even know anything about how they're planning to set that up. I don't think I can comment on that event since I have no idea what they're planning.
Right now, in the last hour, the White House is working on revising social distancing guidelines and maybe making more and specifying what's a high risk and a low risk area. As a medical expert, do you have any thoughts on this change of policy?
We'll need to see what recommendations are coming out, and we'll need to evaluate that as a group and against guidance from the World Health Organization, CDC, Tennessee Department of Health, with our own experts. First, we need to even see what the guidance is. I don't think I can comment on that at this time.
David, I'm interested in the testing. I know that over at UT Health Science Center, they're doing a lot of work making, I just talked to them today, hoping that the lab can process up to 1,000 tests a day locally by next week. Talk about how significant that is in the turnaround time to be able to have that coming online and that type of research and ability here locally in the medical district for folks in Memphis who may be ill.
Sure. Well, we welcome all the laboratories that can bring testing capacity to the community, whether that's the commercial labs, the state lab, UT Health Science Center, or others. In terms of how will that change things, of course, the more people that get tested, the more cases we will find. So we'll become busier, and the case counts would likely, for a period of time, continue to increase, but that would be as a result of increased testing.
So
Sorry,
Claire-
another
With some
question.
of the people who caught the virus early,
Mhm.
how many of those people are getting better? Can you say or no?
Well, we've had a number of people that have been through the whole process and been cleared and released. But as the data from around the world suggests that about 80% of people with COVID-19 either have mild respiratory symptoms or at least disease that's not severe enough to require hospitalization or supportive care. And so our expectation is that for most people that surviving COVID-19 would mean you felt sick, but that you survived it and recovered and continued to do well after that. But there are people that we're concerned about who are more vulnerable, and we are concerned about the transmission rate. This virus is more infectious than influenza, and so it produces more new cases than influenza does. And we know from experience how spikes in the flu constrain the healthcare system. So if it's more infectious and produces more new cases than flu does, what we're trying to do is slow it down through social distancing so that the healthcare system just simply can keep pace.
Next question, Jane Roberts.
David, can you bring us up to date on anything on getting the testing aligned so that people are able to know how many private labs are testing?
Well, the state is collecting, in terms of the number of labs testing, FDA is approving all kinds of labs, so we can't keep up with the number of labs that are approved to do the test. What we know is that anybody who has a positive test, that's required to be reported by law to the Tennessee Department of Health, and they would share that with us. So regardless of the number of labs, anybody diagnosed, we will find out about it. We also know that for this disease, COVID-19, Tennessee Department of Health is also asking them to report the number of tests total, the negative results as well as the positive results. And the Tennessee Department of Health is publishing that number every day as part of their daily updates for the state. They're working on some reports to help us very accurately discuss that at the local level, but those are still being refined. So we're not presently capable of answering that question, but we hope to soon.
Have you seen any new symptoms? I was saying up north that they're seeing that there's some symptoms such as losses, taste, or smell. Have you seen that out here?
We have had anecdotally, some patients have reported that as part of their symptoms, they noticed a change in taste and smell. We have, I cannot tell you how many people report that symptom, but I did interview a patient myself who reported that, so I know that some people are experiencing that, but I couldn't say how frequent that is.
David, we're starting to see, and obviously more of the hotspot areas like New York, we're starting to see hospitals just overwhelmed. In the health department's communication with our hospital systems, are we getting any kind of broad feedback from their supply situation right now?
Sure. So every day, all of the county and city governments are having a task force meeting each morning where agencies across the whole county and the healthcare sector discuss these very things. And that is the reason we're doing that with Mayor Harris and Mayor Strickland and all the agencies and the other municipal mayors and their teams, their agency teams, is so that we can monitor our capability, our capacity, and determine before it gets here, are we gonna have a crisis? And right now, the situation remains manageable, and through the safer at home orders, the health directives, the stay at home social distancing recommendations, that is our goal, is to keep our healthcare system operating within its capabilities, and so far that's where we're at.
Which hospitals have the patients at the moment?
I couldn't tell you which hospitals have patients at the moment.
Is there a sense that for the foreseeable future, is there a kind of a time sense of how the capacity right now moving forward? Is there a big picture if things worsen, or you all look at kind of moving forward if at a certain amount of cases, things
Sure.
like that?
Right, there's various modeling that's going on, looking at different scenarios, and one of the big things that impacts the trajectory of those predictions is how well we have compliance with social distancing strategies. So the more compliance we have with this recommendation, the better our chances are that we avoid a crisis. I think I will take a couple more questions. Was there one up right here? Any other?
I had a question about gowns, masks, protective equipment. What's the supply like and what's the outlook?
Right, so that is something that we monitor through health resource tracking system, and all the hospitals report their PPE levels and along with other things. And we have multiple efforts to try to acquire PPE and get it into the county and get it distributed where it's needed. There's shipments that have been released from the Tennessee stockpiles, shipments that have been released from the federal stockpile. Those are being allocated on a population basis, so that there are teams of people who are in communication daily about those issues, and I don't have any specific numbers, but what we are doing is, as people report a need for PPE, what we're trying to do is connect people who have some with people who need some and get it transferred. And so far, we have been able to support various places with requests. But all of the healthcare sector is in touch with all of their supply chain and making orders of PPE. And obviously, the fewer cases we can generate in the community and wind up in the hospital, that helps us conserve the PPE we have until new PPE arrives.
When it comes to tracking individuals who may have been exposed to someone who has tested positive, how many people do you have on that team that's tracking people?
Well, there's a lot of people involved with that whole set of processes. I think that the easier way to answer that question is, we know how many cases have come in, but some of those other questions that you're asking about, only the investigation process can reveal that, and we are rotating through here. We're operating 7 days a week, and so we're rotating teams of investigators through because people also need to get a break every once in a while and get some sleep and go to the grocery store themselves, so there's a larger team of investigators working than exists working at any one moment. But we have.
You have to say a range of how many people you have overall.
We have several hundred employees at the health department, and many are being redeployed into the COVID response. But on any given day, how many people are working COVID, I don't have a number in my head that I can share with you. But what I can tell you is that you may have noticed that we have reduced certain services at the health department, and certain services have been pushed online. Others are considered essential services, and they have to be maintained. But what we are doing with our non-essential staff, or staff who are not providing non-essential services, we are redeploying many of those people into our COVID-19 response in a variety of different ways, not just the investigation and tracking. There's data entry, there's a lot of different things that goes on. And what we're doing is trying to manage the workforce we have and maintain essential services, but dedicate the resources needed to conduct the COVID response. And that is everyday balancing act that goes on behind the scenes.
Dr. Jane, with the mayor's sort of side of the task force, kind of gave a range, worst case to best case scenario. Do you all at the health department have any rough estimates of that, or has that changed maybe in recent days?
Well, I mean, we've seen the same modeling. We've been in the same meetings with him. We've looked at that data together, and it really is everything you tweak, like the compliance level, the age range of the population. There's all kinds of factors in the model, and every one of them that you adjust, it creates a different scenario. We've looked at lots of scenarios. Some of them are good, some of them are bad, but we compare the various scenarios against our on-the-ground situation today. What we see today is that we are maintaining, right? We're maintaining, the healthcare sector is not yet overwhelmed and doesn't show critical stress, and we are trying to keep it that way.
One more question. Have you seen any changes since it first came out at the end of December? Has it changed over time to this point, the virus?
The virus itself?
Yes, I mean, as far as, I mean, I know it's kind of gotten to a lot of people, but has it
Right.
changed in any way?
I'm not a virologist, and I don't really have any information about that, but it's an interesting question. I know that some people have been speculating about mutations.
Yeah.
We're very, very early in this pandemic. It's only a few months old, so at this point, I think that's an unknown. I'll take one more question.
There was, if anyone, sorry, there was in one of the new Davidson County cases this morning was a 2-month-old baby. Have we seen any in Shelby County, like someone that young, or does that raise a new concern?
I've not seen a report in an infant at this point in time. I can't swear to it that there's no infants in the positive test results that we've received that we're still investigating, but I certainly have not seen a report in an infant at this time. But of course, we're always concerned about all the vulnerable populations, and newborns and infants certainly fall into that category. But the evidence from most of the epidemiology around the world is that pediatric patients do pretty well, and we're not entirely sure why that is. But with influenza, you see more of what was called a U-shaped curve, where the very young and the very old are the most vulnerable. With COVID-19 and the epidemiology around the world, it looks like the older populations are the most at risk. Although, as I said earlier, all across the age spectrum, we are seeing disease transmission. And it's very important that those of us who are younger and healthier than either younger than or healthier than more vulnerable populations still do everything that we can to protect ourselves from becoming infected and to protect them from getting infected from us. All right, appreciate your time.
We're at time. We'll be back here tomorrow, same place, same time.
Thank you.